I'm going to be revealing some things about myself that I hope you don't judge me for. I'm going to thoroughly analyze myself and hope that it prompts you to do the same. Because in the nursing profession, you will need to ask yourself this question and go through the process of trying to get rid of some of these things about yourself. So in nursing school, we were asked this question, and it prompted us to think heavily about the things that we would and would not do. That question was, if you encountered someone that you did not want to provide care for because of inner biases or whatever it may be, stereotypes that you have in your head or prejudices, would you provide care to that person? This is a question that we all must ask ourselves if we're going into the healthcare field, because obviously you're going to be dealing and caring for so many different people. And the ability to not pass judgment, to not have stereotypes within our heart, is at the forefront of nursing. You cannot provide great health care knowing that you hate somebody for the color of their skin. You cannot provide great health care knowing that you are against the LGBTQIA plus community. So for me, I do not like pedophiles. I'm sure that's a common thing that everybody shares, especially if you're a parent. In school, when this question arose, if you were caring for a pedophile, you found out that they were a pedophile because for some reason it'll be in the chart. I mean, it wouldn't have anything to do with the reason for why this person is in the hospital needing care, but it'll be mentioned in the chart for some reason. And you are the nurse that is assigned, would you provide care for that patient? It was a general discussion amongst the nursing students, and the majority of students were really upset about that question because normally no. But because they were going for their nursing degree, they saw the point of the question and started to question themselves. Now for me, the answer is still no. If I'm a bedside nurse and I find out that you are a pedophile, you ain't gonna get the best care. Let me just throw that out there. You probably not gonna get your pain medicine on time. If you need antibiotics, you probably not gonna get that on time neither. That's just what it is. I don't have any trauma surrounding this certain issue, but I have a big issue and a big bias against someone that can take advantage of something as innocent as a child. So I do have issues with that. And maybe that's good for me that I am not at the bedside. Now that is probably bad for me to say, knowing that I am a nurse, but I'm also a Christian. I am a born again Christian. I'm not somebody that passes judgment on somebody that isn't a Christian, but I'm not God. I cannot forgive somebody like that. So I'm not perfect here, but I'm not going to be providing care for that person. Now, if I go to my charge nurse and I tell her, hey, I'm not going to provide care for this person, I have to have more of a reason other than, I don't like pedophiles. But in other times, I just might say, hey, I don't like pedophiles, so I'm not going to provide care and I'm not going to care what she says. But it could be seen as you abandoning your patient. Now, if you have trauma surrounding that type of issue, or the reason why you cannot care for that person, such as that person came in because they were in a fight with their significant other and they were the perpetrator of it. They were the perpetrator of domestic violence, and you have a background that stems and has trauma from domestic violence, then I would think that your charge nurse would be sympathetic and empathetic to that plight and change your assignment. But that can be tricky as well. You would have to reveal that about yourself, and if you're comfortable with revealing that, then by all means do it. But that is the thing about nursing that you need to ask yourself. Now, if you are racist, if you are sexist, if you don't like gay people or the LGBTQIA community, some of us that are older, it is a change for us the way things are now, in the way things were back then. The fact that people can identify with something, identify themselves as something other than male and female, can be a shock to our system sometimes. But nevertheless, you must be able to provide care and check your biases. So I recommend that you do educate yourself. Try to educate as much as you can. You should always try to educate yourself as much as you can if you find yourself having a bias or a stereotype against a certain group of people. And figure out why you have those biases, why they still exist, before you go into any medical profession. And do it before you go into the nursing program. Now, going back to my own biases, could I be wrong in this? Absolutely. There may be a chance that this person was wrongfully convicted of being a pedophile. Maybe they were 18 and they were with a 16-year-old girl or a 17-year-old girl, or, reverse. It's the opposite, because women can be pedophiles too. Maybe something like that happened. Not many of us would bat an eye if you saw a 16-year-old and an 18-year-old going out, or a 17-year-old and an 18-year-old going out, or they were just plain old wrongfully accused and it wasn't them that was the pedophile or the perpetrator of the crime. So those could be possibilities, very slim possibilities, when it comes to me and my ability to provide care to someone that has been accused of pedophilia. So I could check my biases in that when it comes to that case. Now, I could sit here and I could say all this, but if it came down to it, I'd probably provide the care, but not say much else to the patient. That's another thing I can do. Just do my job and not have any type of outside conversation other than, hey, I need to take your vitals. How's your pain level? Just nothing else other than that. But then also that would be detrimental to their care too, because if you're not talking to the person, talking to the person, I feel like, is a part of the assessment. Even if you're not doing an official assessment, you can kind of gauge some other information when you're having a conversation with the patient. So that's what I urge you to do. To go hand in hand with that is, are you able to remain non-judgmental as well? We all have biases and we are all judgmental, okay? We can try our best, but there are certain things that we are judgmental about. Now, I had a patient who was came in because he had a sex object stuck up his butt, and then he wanted it back after the surgery. And, I tried to reserve judgment, but my charge nurse went off outside of the room because she was upset that this man could even ask for the object back. Like we just kept it on a counter somewhere instead of throwing it in the hazardous waste, like you typically do but the nerve of the person. There, she could have withheld her judgment. I also had another patient who, when I was in nursing school, I was following my nurse and we heard a loud arguing coming from the room. Then we go in there and it appeared, although we didn't catch it, it appeared that her boyfriend hit her. And then the nurse took that boyfriend outside the room and also asked him to leave, because this is the postpartum labor and delivery section, and you need a lot of calm. We're dealing with moms and babies and, just monitoring them and making sure everything's well. We don't need extra stress for the mom and the baby. And so I talked to the mom while the nurse is dealing with the boyfriend outside of the room, and I'm just trying to calm her, and she's talking to me, and she's like, he always does this. And I asked her, has he hit you in the past? Did he hit you now? And she said, he didn't hit me now, but yes, he hits me any other time. And so I gave her some information. I believe the nurse put in a request to social work, but I'm not sure of the outcome because I was just there for clinicals. And the next day when I came back, she discharged and we gave her some information on domestic violence and what she can do about it. But those may be triggering events. Not only this, but you may also have sex workers that come in from the outside that are delivering their 11th baby. They're just there to deliver their 11th baby and then leave and discharge without the baby, leaving the baby in the hospital. So placement will need to be found for that baby. And these are hard issues to deal with. These are hard issues to see. But they kind of go hand in hand, what you can see and the biases that you develop, because it's very possible that at the bedside you will develop some biases as you continue to see the addict coming in, or all of the people that I just mentioned come in, and you see them over and over and over again. You begin to get jaded. So you have to have a way to deal with that. You have to have a way to remind yourself that particular people are not all like this. You have to have a way to remain non-judgmental as you can, because this profession will open your eyes to a lot of things you've never been exposed to. But just make sure that you don't walk into this profession with your biases unchecked. At least try to address them, because you're going to work with people of a different color than you. You're going to work with different sexes. You're going to work with just a whole bunch of different people from different walks and avenues of life. If you leave your biases unchecked and you have different people on your team that you have biases against, this job is hard to do when you don't have the support of your team, because trust me, your team is going to know, they're going to get wind of it, and they're not going to want to support you when you have 4 patients and a 5th one admitting and possibly need to take over a 6th one. You're going to need that hardcore team that's going to have your back, and no one's going to want to have the back of someone who's prejudiced or racist or sexist or anything of that nature. So yeah, constantly examine yourself and do something about it, so that you don't take that into your profession and risk losing your license and your career that you work so hard for. Okay? Hopefully this video has been insightful to you. If you like it, please give it a thumbs up. Help the YouTube algorithm, and I'll see you in the next video. Bye.